Hello, my name is Luiza Dobre. I'm the CEO and founder of Comet Health, a young company based in Zurich in Switzerland. We started our journey a bit longer than 4 years ago with the mission to transform the way healthcare professionals communicate and collaborate by helping them take fast and informed decisions and ultimately saving lives. Probably you wonder why we are tackling this problem and how are we going to do it. And inefficient communication, as a matter of fact, is a contributing factor for 250,000 deaths every year and weighs more than 11 billion industry-wide in US alone. In Switzerland, about 3,000 people die every year because of the same reason. So now let's take a step back and understand why this happens. Imagine if you are a physician, you might interact with 50 other healthcare professionals, from nurses to other physicians, other personnel from the hospital, to only take care of one single patient over a stay of 4 days. So this is really insane. Then think that you will have to use pagers, decked phone, fax, a lot of paper, or unsecure messaging apps that every physician has in their phone, in their pocket, a smartphone like WhatsApp. This really makes the whole process highly inefficient because all this information is not integrated, and of course, lack of compliance. So what we developed a communication and collaboration platform that fits the need of healthcare professionals in the 21st century, a platform which is similar to Slack, but purposely built for hospitals. So our idea is to provide in one single user interface, coming on a type of mobile device or a desktop, all in one secure communication hub. And how we do that, on one side, we provide a single interface, a messaging interface, and on the other side, on the back end, we integrate with numerous systems in a hospital, like scheduling system, electronic medical record, lab, radiology reports, and so on, not to duplicate what is in those systems, but to trigger notifications every time there is a new event around the patient, in order to send the right information to the right user at the right point in time on any type of device that healthcare professional is using. How we differentiate? Our solution has been really tailored to serve the needs of healthcare professionals. And there is no other way to do that than by contextualizing the entire information and workflow around the patient. So patient is not the one that healthcare professionals communicate with, but is the topic of a chat. And the only way a messaging platform can work in healthcare is by providing context, clarity, and convenience. And we do this by having an easy integration with different systems in an institution. Here is just a little demo of our application. On one side, we provide a simple secure messaging. This we can implement in a hospital overnight. So let's say tomorrow, Asklepios Group, one of the biggest hospitals groups in Europe, comes and say, okay, we would like to use your app. We can implement it overnight, our simple messaging part. The other part is role-based messaging. So we are shorten the handoff between different roles, like imagine the on-call surgeon and so on, by just making easy for a specific physician saying, okay, I need to speak to the on-call anesthetist today. Oh, it's Martin Kaiser. I can start a chat with him and I can have a conversation. Let's say Martin is taking a break or is finishing his shift and then another person takes over. The entire communication in this chat will never be lost. And the core of our application is really providing patient-centric communication. Here you see, in the moment you start your shift as a physician, a list with all the patients you are currently treating, and each chat is for a specific patient, and every time the first line of care is added and removed automatically based on the scheduling system and based on the association with the patient. And this, in the context of each patient chat, you can receive notifications from lab results, radiology reports, and so on, so clinician can take fast decisions. This was just a little glimpse of our application so you understand what I'm talking about. And the purpose of it is to provide more time with patients, less time for administrative tasks. It's crazy to think that a doctor or a nurse spends 80% of their time doing administrative work than rather spending time with the patient. And with our application, we can save 3-4 hours per day for the nurses. We can have a 50% decrease in patient waiting time and reduce the number of interruptions by 80%, and hence increase the number of the patient that can be treated. This is one of our early adopters, the clinical director of emergency in Inselspital, with whom we have co-developed our application, and it was one of the first early adopters of our application in the pilot phase. So he thinks and he emphasized that Comet can really bring fast, informed decision-making to the point of care. So far, our solution has been deployed in 10 hospitals. We have 5 years SaaS contract with these hospitals. And by end of next year, we will reach with this specific signed hospital a bit more than €500,000. Currently, we have 4,000 active users on the platform, and our growing sales pipeline is growing. At the moment, we have about 300, primarily in Switzerland, but also in Germany. And we are co-developing our application with physicians. So this is really at the core of our development. We have built a sales pipeline. I'm not going to go through the whole sales pipeline, but as you can see, in terms of qualified opportunities, we have close to 12 million euro AR value if you close this account, and we are in final negotiations with 2 accounts. And I know I get always this question. So, it's very hard to sell to hospitals. It takes about 1 year on an average to sell to a hospital. How do you do that? Well, we started by doing pilots. We developed the application with the doctors, like Inselspital. And then we have shown several showcases, like in Swiss Medical Network, Ente Hospitaliere Cantonale, and so on. And now we are really at the point when we are reducing the sales cycle through integrators. So now we are partnering up with the biggest electronic medical record in Switzerland, which holds more than 50% of the market share by one integration. So by integrated with one EMR provider, we can leverage the same integration with all the other hospitals, hence reduce the integration time and the sales cycle. It's an excellent time to solve the 28 billion industry in healthcare. The governments are imposing a lot of decisions that force hospitals not to use unsecure messaging apps like WhatsApp, but also digitalize. And one of the pillars of digitization is really collaboration and communication, but not just standalone, integrated into the workflow. In 6 years, our vision is to be used by more than 500,000 healthcare professionals, generating revenues by more than 40 million per year, with multiple exit options. And we already see this also making a benchmark to what's happening in US. We are very confident that this is highly achievable, if not even more. So far we have raised 2.5 million euros, and now we are raising a pre-Series A of 1.5 million, which will help us reach our considerable Series A by integration with the key partners, like I described just earlier, expansion to Germany, Austria, and Italy, and further enhance the product to fit the demand and requirements of our healthcare customers. We have a small team with big achievements. We all come from business, from healthcare, from medtech. We are surrounded by an army of investors, and we are really motivated to make an impact in this space. And we are confident we have everything we need as a basis to do so. I would like to invite you to join us in this journey to revolutionize communication in healthcare. I'm very happy to take any question right now, or please otherwise connect me on email or any other platform. Thank you so much.